And we'll get going here. So welcome everybody to a new meeting that we're setting up. It's a quick update and open space for practice facilitators on the topic of CII CPAR. We'll be hosting these monthly and you'll receive information about it on the Practice Facilitator Network. And today's our first meeting, and our agenda today is that we're going to start with maximum taking 20 minutes of your time for an update. We're going to provide the current numbers, update on the target goal, new web page that we have that you'll find quite useful, we think. We know people are coming in with Wolf questions, so we will have those ready, and as well as a new document. And then it's open space for you. So at any time, please put your questions in the chat. You can start doing that now if you want. And then we will also stop the recording for open Q&A. So at this time, I'm going to pass you over to my colleague, Sheena George, who is going to give you a bit of an update. Over to you, Sheena.
Thanks, Barb. Okay, just in provincial statistics. So as of September 1st, take a look. When we look at our physicians across the province, we've got close to 300 in primary care, just over 100 in specialists, and we're getting close to our target of 500. So when I say our target, many of you looking at your engagement methods and activities. We've been talking a lot about trying to get to that 500 goal. Now, if you look at the center graph, you see how many PCNs in the province are participating. So we can see that we have 31 of 41 PCNs participating today. So that means there's someone in their clinic, in that PCN, in a member clinic, that is contributing data and information to CII CPAR. Let's go on to our next one. So when you look at the live clinic statistics, we've got these really cool little graphs, these really cool maps, and it shows you going from the left to the right. On the left-hand side, you're going to see all of the clinics. So these are our specialists and our primary care clinics. And that's looking at their deployment by zone. So by zone, you can see the PCN affiliated, we have 60, and the nurse practices, we have 1. And in total, we have 94 there. So in the north zone, you see our numbers. There's 15 clinics. In central zone, you see that there's 13, in south 5, Edmonton 35, and Calgary 25. Now, if you go to your far right, you're now going to see by the PCN. So now we're looking at it in the north zone. We look at the geographical area. So of those 15 PCNs, here's our listing, and we look at the clinics that are in those PCNs. So Bighorn and Bonnyville, for example. So that's how we read our maps. This is a really good tool if you're using engagement and you're trying to talk across within your PCNs to cross your member clinics. Sometimes our physicians would like to see it on a map and say, okay, so what's the actual footprint look like across the province? So if we drill down and we actually want to see, well, what about the physicians within those clinics that are participating? What does that look like? So these are some statistics that help you get a little bit more of a deeper down viewpoint. So on the left, you see the clinics that are in progress. There's 52. Again, super important because we're trying to build up that queue of how many clinics are getting in the queue, getting ready to go live. So 52 are in progress. They've submitted their COPs. 61 clinics now are live when we look across the province, 61. So if you break down the zone and you look from the north zone to the south zone, our graph that's on the far right, the blue column tells you the number of live clinics in that zone. And then the orange column tells you the number of physicians, primary physicians and specialists that are contributing their data. So in the north zone, there's 16 clinics and it's 105 physicians. Edmonton, 19, 64. Central, there's 10 representing 69. And in Calgary, 12 representing 95. In the south, 4 representing 22. So again, some really good numbers to start keeping an eye on and using these to continue your socialization. So what about the panels? So now that we know how many physicians across the province and what that looks like from the clinics within the zones, what about the patient panels? So we're now talking about the Central Patient Attachment Registry, so CPAR. So when you're looking at the CPAR panel data, you can see for family physicians or nurse practitioners, we have 246 panels that are going up, and the patients total it's almost 200,000. So almost 200 patients are paneled to CPAR. So when you think about that, we know it's the paneled patient. So that's representing your primary providers. So we know that there's an opportunity here for, it's an average of 1.7 e-notifications are now going to those primary providers. And on average, if you look across on the panel in a week, that's 14 e-notifications. So why is that important? If we look at the graph on the right, what that's showing you is the total number of e-notifications that are now present an opportunity. So if you look at the North Zone, it's over 47,000 patients are paneled. So over 47,000 patients now have an opportunity for their primary providers to have proactive care, because they're getting notices when their patients are in and out of the ER, day surgery, or the hospital, inpatient hospital. So if you look at that, that's why these numbers are really important, because it's actually telling you the impact. Those e-notifications are only coming to primary providers if they are on CII CPAR. It's not coming to any of the other physicians today.
And Sheena, I'm going to add into that, because this is where this is getting really exciting with talking about the clinical opportunity with CII CPAR. So if we look here, and on September 1st, there were 246, actually these are the August data at the end of September, sorry, the data at the end of August. And that month, 246 physicians sent their panels to CPAR, and these were the numbers. And if you look at an average of 1.7 going out per day, over 400 e-notifications go out per day in Alberta to these physicians because their patients were admitted to hospital, discharged from hospital, or visited an emergency department, or had day surgery. So that's a really significant opportunity for follow-up. And something else that's really exciting that we've been sharing the development of is in next year, for physicians that participate in CPAR and submit their panels, so their name will appear on these patients' record in Alberta Netcare. So that's really cool. And that's going to be in the update to Netcare that happens in June of 2021 to allow other providers across the system to connect with them should they need to get in touch with that primary provider. So really exciting clinical opportunities associated with CII CPAR. Thanks, Sheena. I'll go on to the next slide for you.
Yes, sounds good. So we know e-notifications, we know the imprint there. So what do we know about the patient encounters? So that's that snapshot of information. So when we look at our patient record numbers, you can see over 500,000 patient encounters are now in Netcare. They weren't there before. This is where that community voice is present. That represents over 160 unique patients have now been able to have their information shared and uploaded in Netcare in the form of a community encounter digest report. So that's that CED report now sits there. Over 50,000 consult reports have been uploaded. Again, these are the opportunities that were not present before, and we can see, even though we're getting close to 500, you look at these numbers, it's absolutely amazing how much impact it's having already. So provincial adoption targets. So just in, our targets have changed and the percentage is still the same. We're still looking at 80% of physicians in Alberta will adopt, meaning they're live on CII CPAR. What's changed the year? So they've pushed out the year, it's May 2023 now. This was revised in September, and it was a continuity supports rollout steering committee. So I always like saying that one because it messed it up, I think, each time. So CSRC. There you go. There's our acronym for that one. Okay, so we've reviewed our latest data. All of that data is on our website. It's under the news tab. If you go to that and you can click and you'll actually see those graphics yourself. So at any point in time, you can do the same thing as we've done and just copy them over into a slide deck. What we also now have is physician experiences. So this is a new tab on our website. It used to be called Shared PCN Resources. We expanded it because now we're looking at getting physician experiences, whether they're in a PCN or not. And we're specifically trying to document the physician and teams. And we're looking across the zone to make sure we can start capturing what were the benefits of these physicians that chose to participate. What did they see as the greatest benefit? What do they see as the greatest challenge? Where do they see if they're making an impact? And what do they think in terms of their effort when they were starting the implementation process? So these are the kinds of stories that you're going to see here. Again, another really great place to go when you have just short amounts of time with your physicians and you want to just send something to them quickly. They're in videos, we have slides, and it's the voice of their colleagues. Definitely recommend checking it out, whether it's in your own zone or not. Each of the zones have different stories and there's different focus. One physician will talk about the e-notifications, another one might talk about the importance of paneling and what that meant for continuity. So just when you have a moment, check it out and go through. Our intent is as we continue to move through, we're going to keep adding and documenting those physician and patient stories, and we'll be keeping them here. Over to you, Barb.
Thanks, Sheena. So we wanted to add in today, because we've been getting in some questions about Wolf EMR, and we wanted to add any, answer any questions you might have. So at this time, you might want to put your questions in the chat, but I'll tell you what we know is you might have already heard from physicians or clinic managers that they should have received a communication last week from TELUS about TELUS is going to retire Wolf in 3 years. So they've announced that to their clients, and they've told them that they are going to shift them to Med Access. That would be their desire, and that they are offering within that some fiscal incentives for them to do so. So we've been getting questions from the CII CPAR project point of view of what does this mean? So I can tell you what we know right now, which is just a little bit, but we are working with Alberta Health to gather information from TELUS. So what we do know right now is that we already have a clinic right now that was actually already implemented on CII CPAR, and months ago they had already made the decision they were going to join the EMR instance of a Med Access clinic and are going through that process right now. So the good thing is eHealth Support Services is already learning from that experience of migrating the clinic from one EMR to another, and TELUS is also learning because particularly the not the CII part, but the CPAR data elements of the demographic data elements that are submitted each month to the Central Patient Attachment Registry. We want to ensure that those are migrating cleanly from Wolf to Med Access. So they're monitoring that and they're using this as a learning experience. For clinics that are in the queue right now and might have already submitted their confirmation of participation form, the eHealth Support Services team and us, we're trying to get information from TELUS, but a lot of it is going to be dependent on when the clinic plans on shifting to Med Access. If they're going to be doing it later, then they can go on to CII CPAR while they're on Wolf, and then the migration is going to happen later, and likely many other clinics would have already gone before them, and also TELUS will get more and more experience with the migration process. If they're actually going to say, wait, hold on, I'm thinking about going right away, then we have to look at timelines, and because it would be a lot of work for them to do all the paperwork, start CII CPAR, and then immediately there has to be a whole bunch of new paperwork because they need a new privacy impact assessment with a brand new EMR instance and things like that. And there would also be some impact on their registration and paperwork with CPAR. So for those clinics that are like imminent and right in the queue, we're trying to find answers so that we can get back to you. All right, I don't see any questions in the chat, but I do see some questions. Are these slides going to be available? And we will put them on the practice facilitator discussion board. So I'll look if there's any more questions coming in about Wolf. I don't see them. But also, and the other key message we want to mention is Ultimately too, TELUS should be the best source of information for their clinic. So if they have questions, absolutely contact TELUS, because they should be giving them answers as well. And if they have timelines for clinics to migrate, they can tell them that quite accurately. So the other thing we wanted to share with you today, and we're getting close to our 20 minutes, and we're going to try to stay true to that to give you an opportunity for open Q&A, is there are some other resources on our webpage. And I will go in through the Practice Facilitator Tools and Resources page and show you that we do have a new document, and we put it in the post-implementation area. And it's about locum provider absences and panels in transition. And I'll just click on it to show you and why this document has been added. So we added this as a tool. You're probably only going to want to look at this when you need to look at it or a clinic has a question. And it's about what happens with locum data in the EMR. Does that go up or not go up? And there's all kinds of dependencies, and it's likely due to how they are set up in the EMR, as if they're set up as an affiliate for the physician or as an independent locum. Also, there's guidance in here is if a physician is going to be absent, maybe they're taking a medical leave or a sabbatical out of country, what happens in CII, CPAR in those stages, and when do panels get put into transition. And the point today is for me not to go through this in detail, but really to show you that it is here, and there's all kinds of question trees that help you get to the right answer, so that you can just really point clinics to the right answer when they're in this scenario of clinics coming, providers coming or going, and what happens to their panel and CPAR. So again, you will find this document. It's in different areas of different pages, but in the Practice Facilitator Tools and Resources page, we put it in post-implementation. So it's likely after a clinic has gone live that you might have these questions. So I'm looking at the chat. I don't see any questions at this time. I already did that. But this is the opportunity for open Q&A. Look at the chat for a minute longer, and then we're going to turn off the record so that anybody who wants to get their questions answered but doesn't feel like going on a recording can ask them. I still don't see any questions in the chat. Here's a great question. Any update on the patient summary functionality for CII CPAR? Good question. So we talk a lot about the community encounter digest, and many people say, can the community encounter digest do this or that? Because we want to put the full history in, and we want it to represent more of the patient's history. And the community encounter digest was never really designed to do that. Actually, while I'm talking, I'm going to click on the CED so that we can know what I'm talking about. The CED was meant to be a rolling 12-month snapshot of patients' encounters across enabled clinics in Alberta. So it's really meant to convey visit information. And actually, I'm going to go to this page because I know where I can find it faster. So the CED wasn't meant to be the patient history. The CED was meant to be that rolling 12-month snapshot. So we've already told you that there is going to be something called a patient summary. The patient summary is going to be a document that is created at the primary provider's clinic. It might be a combination of the physician and a nurse doing it or other team members. And it's meant to convey all of that which people are trying to submit through the CED, which it really wasn't meant to do. So it's an opportunity to include the history of that patient, include their problem list or profile items, allergies, failed medications, failed treatments, and that will sit on Netcare should they end up in emergency, and a physician can really get a much more comprehensive view of that patient to appropriately treat and manage them. So We've heard that the budget for that has been approved, and it's in the process of being contracted with the vendors to do it. And we're likely to see it next year, which is really exciting. And that will be another value proposition for physicians. Okay. Okay, here's another question in the chat. If Wolf users are changing to MedAccess within the next 6 to 12 months, would you suggest waiting until they're migrated to connect to CII CPAR? What will that time frame look like? So that's a great question, and I'm sorry I won't have an exact answer. If it's closer to 12 and they are eager to get their panel information in CPAR and getting e-notifications rolling, they might want to go now. And with the caveat that there will be some paperwork at the time of go live, and they would know anyway that they have to update their privacy impact assessment when they change EMRs. If they say that, oh, I don't want to do that twice, no matter what the timelines are, that's obviously a clinic decision, depending on that. So the paperwork, when you shift an EMR from the CII CPAR perspective, isn't that onerous, but there is some. The PIA is the biggest work, and then obviously eHealth Support Services would coordinate with TELUS when that change takes place, and there would have to be some configuration that the vendor's doing, and then the new instance would have to be configured as well. Sorry, I don't have a hard answer for that. Okay. So is compatibility or conformance likely to switch to other EMRs? That's a question that we are getting. So the answer, this is obviously a fiscal decision from Alberta Health. And the answer at this point is right now, there are not the resources. And when they say resource, they mean both fiscal and people, because it's quite intensive to conform another EMR to do it at this time. So it's not on the books for now, and it's something that Alberta Health would look at in the future. We do know, and I see in the chat, that some clinics are moving over to AVA, but that capacity to conform a new EMR does not exist at Alberta Health. In addition to the ones that we have conformed, the 3 TELUS EMRs, MedAccess, and so MedAccess, Wolf, PS Suite, HealthQuest, and Accuro. Epic, it of course has to be, there's some conformance there because there are some AHS clinics, that primary care clinics, that will be submitting panels to CPAR. And actually there's another First Nations EMR called Okaki that will also be added. But other than that, there are no other intentions at this time. Any other questions coming in?
Or maybe just show where the news tab is again on our website.
Absolutely. Yeah, if people haven't been here, we reorganized our news page too.
So that monthly statistics that you see, that's where we're also pulling information from. So we'll provide the slide deck for sure from today. But if you're ever wanting to look for updated stats, you can come in here too and take screenshots or snippets or snippets of different pieces of information that you think would be useful. Or you can send it off as its own PDF.
Yeah, and this is where we get stories. So this is one of our latest stories that was published. And some of your physicians might also be directed to these stories through MD Scope, which goes out to AMA members. And it's also published in Networking Notes and Primary Care News.
A question about PS Suite implementations. Is there anyone on the line that has a PS Suite clinic that they took live on CII CPAR? Misty, great. Or sorry, can you share that experience?
And you know what, Sheena, maybe at this point, I'm going to turn the recording off. Is that okay?
Yeah.
I think that's fair. We're going to stop the recording.